Can't miss skip Mr. Cowell.
All right.
Not about praying anything. Okay, this time we have a update on employee care center update. Mr. Cook or Ms. Dawn?
Thank you.
Don, start it off.
Good morning. Don Brook with the My Benefits Group, and we're here to give an update on the Wellness Center and on the self-insurance plan. I'm just going to give a couple of brief opening comments. One of the things when we started this process, we set out with basically two objectives. One was to control costs / premiums, as well as the other objective was to bring value to the employees. Through doing that, the premiums, when we set the premiums at approximately 8% under what the Florida Blue came in for a fully insured plan. So we've been realizing, whether it be the school board or the employees, realizing the premium savings throughout this year. Looking at the claims, although it's still early in the plan, especially in the first year, claims are running well. We are currently sitting with a surplus of approximately $600,000 in the fund. I do want to caution on that because the funding, the 9-month funding of the premiums. Premiums being paid over a 9-month basis. Currently we're sitting at approximately $600,000 surplus, but we still have claims coming through over the summer without the substantial premiums coming in during the summer months. So I do just want to caution on that, but at this point, and looking at the projections down the road, things are looking very, very well and setting out what we had aim to do at the beginning of the year. And then from a value standpoint, the Wellness Center, I just want to make a comment to the school board, to the district, what a fantastic job. The transformation process of the house over there and turning that into a wellness center for the employees. You walk in there, it's amazing what you see over there. And the school board and the employees who worked on that did a fantastic job. From an employee perspective, it's providing them with value from the standpoint of accessing medical care at actually zero cost when they use the Wellness Center, which is also having an impact on the claims. With that, I'm going to turn it over to Brian and Kara here to talk about the Wellness Center and kind of give an update.
Good morning, all. Just briefly, I know we've got a short amount of time, but I just wanted to run through, kind of give you some utilization numbers, how the center is being used, and I'm going to have Christina talk about some of the wellness initiatives that are taking place with the employees, and just walk through a couple of key points to point out to you to show you how the health center is working thus far. And everybody has a copy of what's being shown on the screen. If you just look at the total number there, we've done just over 2,100 total medical and ancillary appointments to date. Averaging, from a medical standpoint, we look at two different appointments. We look at ancillary, that would be a blood draw coming in, and the medical appointment obviously is being seen with the provider. And from an average standpoint, for medical appointment capacity, we're averaging 76% utilization of our appointments, which is very good. As I've told Donna, typically you see a high utilization in the first couple of months because that's the HRAs, and the follow-up you usually see a little bit of a downturn, and then the utilization starts to pick right back up, and we're seeing that right now happening. So and this is going to plan. Unique patients per month. These are our individuals that we're seeing each month. We're averaging 147 unique members a month. So, for example, if you look at June, we had 258 appointments that are our capacity appointments. 79% of that number, which is, calculate that, but it's just over 200 of those. 118 unique patients were those. So some folks may have had a double appointment, or they came twice in a given month. That's just telling you um, who's coming. So we're getting repeat visitors, is what that indicates. No-shows, we track no-shows on a monthly basis because that's important. Because when an employee books or a dependent books an appointment and doesn't show, that is accounted as an appointment because the individual, the doctor, didn't get the opportunity to see that person. So what we've been stressing with Donna and the team is that those, if you know you're not going to show, or if you book, we've had this happen at other locations where an employee would book 2 appointments in a given week and forget to cancel the one and go to the other. When we're only having 32 hours a week here, that's an appointment that otherwise could have been used by another individual. So we're stressing that if you know you're going to miss the appointment, please call, cancel, and we'll reschedule you to get you in. So that's how we track that. And it's not terribly of concern, the numbers right now. But if it does start to creep up, we've sent out mailers and emails and such to keep educated employees and dependents to make sure they cancel the appointment. Health risk assessments, 370 total to date, which is outstanding. And if you look at the prescriptions, we've done just over 1,000 medications since inception, which is again great number to have. And especially when you look at the cost avoidance to the plan. When we buy and stock, simvastatin, for example, for $6, we're trading that $6 for a high cost on your plan. So, if you turn to the next page, these are some of the diagnoses that have been coming through the health center. And if you notice the large counts there are obviously with hyperlipidemia, hypertension. If you come down, you've got obesity, you've got you've got a lot of chronic need and help where the patients now are coming to the health center and seeking care. And if you look at the diabetes, this is coming in and being diagnosed. There's 14 that were actually diagnosed that had come in. So in another chart, I'll show you that we're actually treating the high glucose level. It doesn't necessarily mean that you are diagnosed with diabetes, but you have a high glucose, and there's folks that we're treating.
I have a question. I'm the only person in the room that doesn't know this. What is hyperlipidemia? I was looking at it. Is that like cholesterol?
Cholesterol.
Okay. That's what he specified. But
Hyperlipidemia is cholesterol, hypertension, you do blood
I
pressure.
got that one. I don't have that one, but I know what that was.
Okay, sorry, hyperlipidemia is
I'm sorry. All you folks that knew, I'm sorry.
Lipids.
sorry, I should have.
He knew.
Parts of your words.
Separate those seats.
So these are the medications. There's some acute medications that are high count there, allergy type medications. But these just give you kind of a rundown of what's being dispensed at the health center. So a combination of acute medications along with chronic medications. So that list, we have a on-site pharmacist that works for us. She monitors the formulary, she speaks with the providers, and we maintain that formulary on an ongoing basis. These are this is just a quick snapshot of your lab values. This just kind of gives you a workup of the HRAs that have been done to what the levels are looking like. And what we try to focus on is one is you got the high and you got the borderline. The The high folks, they already have a condition, they have you know, a chronic issue going on. So we're trying to maintain that, get their medications, get them into wellness programs. But more importantly, there's the borderline where there's folks that aren't into a high category or haven't been diagnosed, that through these HRA values we have established that they're heading in a direction that we need to head off. So we have had engagement in the wellness programs. Every time I've been to the health center, Doris is behind closed doors with folks. So she's meeting with a lot of people, getting them straight. The other thing I would like to do is have Christina talk just for a few brief minutes about some of the wellness initiatives and future projects that we're going to implement for them.
Morning. As Brian said, Doris, our dietitian, is on site regularly at the health center, and she's helping patients manage weight loss. If we have diabetics, we have a diabetic management group that she's helping patients with. We also have an exercise physiologist who will start, who's been coming out to the health center, and she's had some great response. She's teaching patients how to use exercise therapies and getting them into an exercise regimen that they can do at home, and then they can follow up with her as well. One of our other popular wellness activities that we're doing right now is our mental health coach with stress management. We've had quite a few patients that have been referred into that program. We are promoting some other programs such as the smoking cessation, and right now our provider on site, Dr. Khan, is doing skin assessments on patients to bring them back if patients need biopsies or something of that nature. We have a provider that will be joining us in August. He'll be able to do those types of procedures on site as well. So that'll save costs in reference to dermatology referrals and hopefully prevent some skin cancers if we can catch those benign lesions at this time. Some of the other exciting things that we have planned in the fall, we're going to go out to the school locations and we're going to do flu clinics. So we'll offer the flu vaccine to those staff members on site. The district has decided to open that up to all employees so that we can keep those teachers and food service workers and bus drivers at work to prevent the flu. So those are just some of the things that we have going on in regards to wellness and preventative measures at this time. Any questions? Brian?
Next slide is just to give you an overview of potential savings, and this is from a several institutes, national institutes that project the cost of these chronic ranges of diseases. You've got the National Institute of Health is what when we look at the diabetes, there's a cost associated with those individuals that and it's an annual basis, and it can range anywhere from $10,000 to $14,000 a year cost. So right now, and the thing is to focus on is not so much the projected savings, but really is the number of health center instances that we're able to get folks engaged. For example, with the diabetes, 105 is not clinically the number that you get diagnosed for diabetes is 115. So 105, we do it at a pre-diabetic level, if you will, at 105. So when we get a person that's over 105, we're actually getting them engaged, trying to get them compliant, giving out the metformin strips. This just gives you an idea of potential numbers because it's very, very expensive. I'll tell you, and we will do this here after we finish our full year and we have a full mature year. We just did an analysis of another school district. And with our data analytics tool, we'll be able to separate and tell you those individuals that are coming to the health center versus an individual that's not coming to the health center. We can look at a diabetic, for example, and tell you those that are coming and being compliant, they're getting the A1C, they're getting the regular blood draws versus one that's just going through the plan. And we did that for the other school district. It was 3 times the amount of money for the one that wasn't compliant. So engagement is key, and just like what Christina said, we're doing multiple programs to get folks involved. So very, very pleased to this point in terms of the engagement, participation. So, and like Don said, you know, it's early with the claims. We're 6 months in, 5 months into operation of the health center. This slide here is showing you when we were here back in late last year, September, October, we talked about the budget. What are we going to need to budget for in terms of the health center, in terms of the Florida Blue to pay our claims, and our fixed costs are to pay Florida Blue our administration fee, and the Symetra that covers our reinsurance in the event that we have a catastrophic claim. Which is another good point to note. We monitor this monthly. And we start monitoring claims once they exceed 50% of your specific deductible, which is $150,000. And to date, we have no one at even 50% of the deductible, which is very good. These are the projections, and this is the projections through 6 months to where we are actual in terms of operating the health center and our fixed costs for Florida Blue and Symetra and the claims. So just like Don said, we're just over 600,000 right now running to date. But again, we have a couple of months here where the revenues are going to stay put, claims will pull down. But then when we start taking up the premium, I would anticipate that number to shoot right back up. In terms of the employees, when you break down the number of actual copay avoidance, we like to show that the employees have saved just over $36,000 in copays, where they would have had to gone to their plan, they would have had to make this type of copay. So there's a claims of cost avoidance for them as well. We're now doing DOE exams. When we talked that there was about $160 cost that would have been charged to the board, to the school district, and now that we're running them through the health center, those costs are already paid for. When you look at the number that we have done, we've done 48 so far. It's just over $7,600.
What would Department of Education need to think for that? Bus driver.
Bus driver.
Physical.
Okay, but so that's not DOT, or it's for DOE?
Well, it's required by DOE for bus driver. And Mr. Chairman, I would like to remind you too that not only was the cost of the physical exam going to go up significantly from what we were paying before, but we were also having problem in finding a provider because the providers now to do a DOE physical has to have 60 hours of training, even though they're a medical doctor. They have to have 60 hours of training to be able to do a DOE bus driver physical. And both of our physicians, the one coming on and the one currently, have had that training. So it has been a huge savings for us in not only cost, but in trying to figure out where we're going to get those physicals done.
So it's good. Christina, on a monthly basis, will she has a suggestion and comments where she will ask for feedback from the patients. And she does that on a monthly basis, and we review that monthly with Donna and Kaylee and the team. So this is just some of the what they're saying. 80% of our folks have less than a 5-minute wait, which is what we told you. And I think that's part of the satisfaction. Also, the other big part of it is our position there. Dr. Khan is she's very personable. I think the employees have taken a liking to her. They trust her. So, and I think the same thing even with our new provider coming on in August 7th?
August
13th. So that will be another good addition. But you can kind of read some of the comments that they've said. Rula, again, is our exercise physiologist, so she's been very involved here, getting folks going. So I'm pleased through 6 months, but again, early, and things are tracking in the right direction. Questions?
Is the new doctor going to be seeing children?
Yes.
Yes. That's one thing I felt was kind of,
Yes, sir.
Yes,
We will see 8 and above.
but not 8 and below.
He will see 8 and below. We can treat from birth to the grave, but the district's decided on the age of 8. But if a 7-year-old comes in and, has an acute illness, he's not going to turn that child away.
Yeah, typically it's acute need. We don't really stop pediatric medications or anything like that, or we don't chart, so it's not to replace the pediatrician, but if it's an acute situation.
My biggest concern was juniors got cold.
Yeah.
Yes.
Because we tend to,
Absolutely.
that goes around, and we have a lot of teachers who are mothers and kids want their mothers. And we're trying to cut back costs of mamas not being able to be at work. And that was one of the big benefits. And it seemed to me like when we didn't have a pediatric over there, kind of weren't accomplishing one of the things we set out to do there. Other than that, I think the thing's fantastic, wonderful. My experience with it, been very good.
Great.
I speak to that also from what Mr. Asbury was saying, personal experience as well. Saving money, not having to drive somewhere else, to a doctor in Gainesville, Ocala, or somewhere. Dr. Khan is so thorough, she makes me angry. all the things, instead of just focusing on 1 or 2 that she addresses. And we all knew from the outset for this to work, it's got to be utilized. So shame on us as a district if we don't continue emphasizing this to all of our employees. Shame on the union if they don't help us, with the employees by encouraging this. I've only spoken to 1 or 2 that have told me, well, I just would rather go back to my doctor. Have you been over there yet? Well, no, I haven't been over there. So, all of us, because we know for this to work, and I think we're seeing the numbers here today, that the potential is still really there. So, I remember before this coming on, one of our big things, all the way back to when Mr. Alexander sat on the board, was insurance premiums. How much were they going to go up? Can we afford to pay? And with this coming along, I think the solution is there. As a personal observation. But we have got to get the people committed to use it.
Mr. Turner, we're going to continue to work on that from in-house out. We're doing quarterly newsletters to our employees. We've invited Christina to the employee orientation, the food service orientation meeting, the bus driver orientation meeting. So we're going to put the face of the care center out to our employees as much as we can. I think you're absolutely right. We need to keep the utilization up. And I think a good day will be when we raise that 32 hours to 40 hours. So that's our goal. And so we'll keep at it.
Yeah, I love having the newsletter too, and I appreciate the update too after 6 months. So I think it is a good thing, and as much as we can get out, there and tell everybody, I appreciate it.
One thing that excites me about it is, even though I have not taken advantage of the situation as yet, but in fact, Mr. Turner said, but the thing that excites me about it is that, regardless of what some people think, I think we're one of the few counties in the state of Florida who still provide total health care for our employees. And if this will help us continue to do that, because I think that's money. Now, some people in this room may not think that's money, but I think that's money if we can pay premiums for our health insurance for our employees. And if this will help us continue to do that, I think that's fantastic. Mr. Ted, you might have a comment about this. Is anything to that rumor?
Yes, sir. The comment that I would have is my department utilizes it thoroughly, and they would be one of the 80% portion of it. I've heard no complaints. I think it's great, especially for minor things. They got a cold or sinus or whatever, they can go there and treat it and get some medicine and stay on the job. So they're very, very happy with it.
Mr. Phillips.
Yeah, you've heard a lot of the cost benefits and the economic standpoint benefit for the health center, but coming from an academic standpoint, the health center focuses on the wellness of the employee, and whenever we keep the employees well, improving their health, we're putting a better teacher or a better bus driver instead of a substitute for the kids. So from an academic standpoint, it's been very beneficial in keeping the highest qualified people in front of our kids.
I had a personal experience. So right before the health center came on, or right before it went live, I should say, my daughter had gone to the doctor and she got a lab. Well, I had a situation that really could have gone bad, so I made an appointment for her, even told the person who it was for, and had to go back and sign her up. Well, get over there. Dr. Kahn hasn't seen anybody at 18, she's 12. So I'm sitting there and I'm thinking, I have this doctor who's issued a lab, and I think, Christine, I may have got you on the phone. So I don't easily take no for an answer. So I talked to Christine, and we got it worked out. They did the lab work and everything. The girl who did it, I can't remember her name, she eased my daughter, who does not like to have blood drawn. Everything went swimmingly, and so it was a cost savings to me as a father, not having to drive back to Gainesville from Cedar Key to make an appointment at Quest or go sit at Quest to get blood drawn. And I really appreciate you doing that. So, and I echo the sentiments about needing that other doctor. And if there's any way we could adjust hours where we could have maybe some evening hours or Saturday hours, I would love to see that too, because that's a couple comments that have been made to me by employees.
That has been on some of the previous suggestions, evening hours, weekends, and I think in time we'll get there. Audrey works with Donna now. She's used to be at Citrus Schools, and same scenario. They started out 40 hours. We're now over 90 hours.
And on another note, in June, I was sitting with a couple of Suwannee County board members. I don't know if you've been in contact with them, but Suwannee County is looking towards this, so they would be a good contact. And I told them what a good job you guys have done for us, so please contact them.
Yeah, there's other jurisdictions that are watching and looking still. Oregon's one. Actually, Madison schools working with them now. So there's starting to get up towards the Panhandle now. Get to the smaller rural counties that desperately need it. It's heartbreaking when you talk to county government or school district that I believe it was Gulf County. I met with them several years ago. They had one primary care doc in town, and he wasn't accepting new patients. So either everybody was already with them, or you're traveling, or you're going to the hospital. So those types of things that we really feel for, and that I think it's a great thing that the board implemented, and I think that it, with our past experience and with 30 other centers now running in the state, I think tracking in the same direction as the others. Thank you.
Mr. Chairman, I would like to say that our experience with working with Care Here has been really a excellent experience. Brian is very good to work with, and he's got all the numbers plugged in his head. Christina, who administers our clinic, she's just perfect. We have monthly meetings with the administrative team at Care Here to go over any issues that we might have or any initiatives that we want to start. We are now having talks about the clinic or the care center doing our drug testing because currently we have to send people to Gainesville, so we're hoping to put that program into the center very soon. And Christina is just on top of everything, and she does it with such a sweetness and a smile, and so it's been really great working with these folks. And Don keeps us on track as far as numbers are concerned. And we gave you a schedule, a proposed schedule for our enrollment, and so we're bringing the real numbers back to you, hopefully at the October 7th meeting for the renewal, to let you know what the premium numbers are going to look like. So the administrative team will be working with Care Here and with Dawn to get all of that put together, and then we'll bring those numbers back to you to move forward into 2015.
Mr. Lane?
Just a question. Understanding that it's important to get participation from all employees across the entire district, do we have any data on the levels of participation based on different job categories? Do we know how many of our ESPs are coming versus how many of our teachers versus how many of our administrators? And that might direct our recruitment efforts.
Yes, and what we're doing right now is we're not looking so much at the groups, but the demographics. So are we getting participation from senior PMA? Are we getting participation? So we're looking at it from that perspective, but we could also look at it from the other perspective as well.
Thanks.
One thing I think is also going to help with the drug testing is you're going to pull people in to the drug testing. You'll pull them into the health center that they otherwise, may not have, they may have whatever opinion of the health center, preconceived notion without ever having been there. You pull them in there and all of a sudden they walk in there and they're like, wow. Because some of your employees may still think it is the old coach's house. And they may still have that preconception. All of a sudden you drag them in there and they see what's taking place on the inside and the professionalism there, then I think that's going to give them, maybe I will come back here. They'll help too.
Well, I think Kaylee can speak to the fact that when she sits with new employees doing their insurance, she does a great job at going over the care center facility with them. And most everybody that I hear is excited about that. Number one, they're very excited that the board picks up 100% of their health premium. And number two, the fact that they can go to this care center with no money out of pocket. We're getting good feedback from new employees on this.
Maybe just sort of a soundbite number that the average employee is saving X dollars per month. I don't know if that's part of the pitch, but it sounds like those numbers are there and available. That might be useful.
We also included it with recruitment efforts, and we had a sheet explaining how much the board contributes towards their overall health insurance, and then we had the Care Here Center, and so we use that as a salary on one side and then benefits on the other side. And that was how.
And I'll have a savings number on the scripts. It's a little, I have to use the data analytics tool to do that. Once we get those claims in that, it'll allow me to pull out the savings because we claim design, it's not just a copay. It'll allow me to look at the number of drugs that are going through and be able to add that to the 36,000 because there are, what otherwise that cost associated with medication that they're getting now.
Thank y'all very much. We appreciate what you do for our forward. Mr. Clemens?
Thank y'all.
Thank you.
Thank you.
Should have in front of you the advertisements that you get in the newspaper. As you know, we're going to meet the training requirements. We will be putting this in the paper this week. And then Monday, we will be having a board meeting to do the preliminary, the tentative village budget. I know there's a lot of numbers on the page and the print is small, but $79 million budget. So, of course, it's larger this year than it has been in the past because we have the special facilities, a third of the special facilities award of $11 million is going to be passed through here. So, I'm pleased and excited about that. There is a difference this year than what you've seen in the past. For those of you who've been on the board for a while, it's the last time we had a notice of proposed tax increase was 2007. This year we do have to advertise a tax increase according to the trim manual. When I go through the calculations, if we get a positive number on line 22 on the certificate values, we're required to advertise a tax increase. The number was 0.25. So it's a very small percentage increase. We'll talk about all that here. Sometimes the public doesn't quite understand that, but it's strictly as a result of the property values increasing. So I think that's a good indicator. To me, it tells me that perhaps we've stopped the slide. We're no longer losing values. So I don't think any of us want to return to double-digit increases in property values. That was some scary times, but it is good to have it stabilized so that we can have a good foundation going forward. Any questions?
Yeah, I have one question. It said we're going to do 5 vehicles, buses.
Okay, the capital outlay ad, I have to advertise those. We may or may not buy them, but this is required in the Department of Revenue. They require the language that's on that page. And if we are going to buy buses, of course, these funds, the LCIF funds this year, the next 3 years are actually all going back to the Department of Revenue. So we won't buy anything out of that money. We're getting a new school out of it. But in the event that after that 3-year period that there's some delinquent taxes who still come in, we could use them for these purposes. So you have to advertise it. You don't have to use it like you advertise it, but you can't use it if you don't advertise it.
Right. Well, and also this is a little off, but I was asked about our buses that we don't use anymore, and I said they're auctioned off. Is that correct?
At some point they are auctioned, yes. We are actually behind in our bus replacement schedule. And we're going to get further behind because for the next 3 years it's going to be difficult to buy buses.
So we haven't auctioned or sold any or anything lately?
Not
this
lately,
year.
no.
It's been about a year and a half ago.
But we do take them to a sale, and that's why they're
We
done.
do have an auction.
You will see them declared surplus.
Yeah.
That's exactly what I thought, but I just wanted to make sure I was answering correctly.
We did recently sell one to a nonprofit, I don't know if you remember that, food distribution, children's table.
And we did sell
That
it.
was about 3 months ago.
Sell to them at an auction price, so. But yes, we do auction
Okay.
surplus buses.
All right, that helps me. I'll make sure I answer correctly. Thank you.
Sure.
We advertised 5 buses last year, correct?
We did, yeah.
When's the last time you bought a bus?
I have to bring you the information, I don't know, it's probably been 3 years, I would guess, 2 years.
It was 2 years ago.
Yeah. But I have a schedule, I'll bring it Monday and let y'all look at that.
I'll catch up with you Monday if we don't.
Well, it's gonna require our maintenance cost to go up for sure, you know, but,
And what was our millage rate this past year?
okay, that's your question. The required local effort has gone down, actually. Required local effort last year was 5.073, and this year is 5.031, so the overall millage has gone down 0.04%, so the millage is not the problem, it's the property values, that's what's driving the tax increase. So,
But, okay.
the values actually went up 1.5%, the property values.
Right, but we're not increasing taxes.
You're not.
Property values are going up.
Exactly.
We're actually lowering, that millage rate is lower, so, I mean.
I understand, but that is what the Department of Revenue requires for trim. We have to advertise it this way.
Yeah,
So it's regrettable, but that's the way it is. I don't know how to help you. That's all I can tell you. Yeah. Property values, the increase in values and property values is what drives the tax increase notice. It's not the millage. So there's really nothing.
right.
Yeah, it is. So
Can we add anything to this?
there's no way to add any language to that. It's prescribed language. And you can't even put an article beside the ad explaining.
Okay.
But we can tell them.
You can tell them if they call and ask you. That's why I was letting y'all know. This usually brings people to our door when we advertise the tax increase. But there may be more people at our meeting than have in the past. We'll just have to explain it to them.
That's at 5 o'clock Monday, right?
Correct.
Monday, yes, sir.
And just, we have to levy the required local effort in order to participate in the FEFP. Because if you don't, then do what the state says, and we don't get the money.
What would be the difference if we went with the rollback rate?
Well, we can talk about that Monday.
Okay,
Certainly will.
all right.
It would,
So what are you looking for today?
I'm just looking for a motion to approve the advertisements to go in the newspaper.
So moved.
Wait just a minute, please.
Okay.
I have a question.
Okay.
Maybe kind of a dumb question, but on these payments for education facilities and site, under a lease purchase agreement,
That's the COP.
right, what happens to these places that Wilson Middle? When we get a new school, we still got to pay for it? I mean, I know that's kind of a dumb question probably, but.
Yes, sir. It's like signing a promissory note. We still owe the money. So, yeah.
And so, do you have any idea what the balance of those two?
I do. I do have that information, and we have been in correspondence with attorneys trying to do a swap so that we could add bays in another campus and liquidate the balances that are there. But after looking at it, I think it'd be wiser to just let it run off and continue paying the values. I don't know if it'd be worth the cost involved to do the swap. And there'd be no added value to doing that.
How much longer do we owe on that?
I'd have to look. I would say probably 10 to 12 years.
Okay, so what happens?
If we wanted to sell it or give it away, we would have to do what I just said.
Pay off.
Either pay it off, we could pay it off, or we could do a asset swap with another campus.
And then we would not be responsible for that anymore. Well, we would be, but not that particular.
Right, right.
Okay.
We have explored the possibility of doing an asset swap with another campus. But it's going to be an expensive operation to do
So you recommend right now we just keep paying what we're
that. I think so, unless we have a definite plan to liquidate that property at Wilson or to sell it. At that point, we could have a conversation. At this point, I don't think we count it for a swap. We did explore that.
And I'll entertain a motion. You have a question? First, another comment?
We already have a motion.
There's a motion and a second.
Okay.
Discussion.
Thank you. Any discussion?
I have one more question.
Yes, sir.
What was last year's tax levy that we did? What's the increase on? Do you know that?
tax levy.
on this, that we're at, what was the numbers that we advertised last year?
I'm not understanding your question, I'm sorry.
Okay, so the increase is 0.25% over this 12,668,119. That's 0.25% more than last year that we advertised. Is
Yes.
that correct?
Right.
That's what I was wondering.
Any further discussion, comment?
Okay, just so I'm clear, we're gonna advertise this and put it in the paper, but we're having a public meeting on Monday. Will people have time to get that advertisement for Monday and see it?
Well, this is what's required in the trim. We are required to advertise it, and then within 5 days, we have to have a public hearing. So it will be a public hearing, it will be announced as a public hearing. They'll come to the meeting, we'll have the meeting, and either accept the proposed budget and millage, or do something different, rollback rate or whatever. And then we'll have to have more conversation, and then in September, we'll have the final hearing. We're required to have 2 public hearings, we'll have the final hearing to adopt the millage and the budget at that time. So plenty of time for public input and questions
Right.
and resolutions of issues. So
Okay.
That meeting time's 5.
5:01, yes, sir. It has to be after 5 o'clock.
Any other comments, discussion?
So if we accept this, and we advertise this, we can't go back with a rollback rate or anything like that, correct?
No, sir, you can't increase the millage, reduce the millage. But in order to reduce the millage, you put in jeopardy the FEFP, so.
Well, not reducing it, but what if the rollback rate is a 5.073, which would be higher? We can always come down.
So you're suggesting that we advertise the rollback rate?
Yes.
We've never done that, but we can certainly take that track.
Why would we want to do that?
Generate more revenue.
But do we have to approve the one that we advertise?
No. You don't have to approve the one you advertise, but you can't increase.
You can't increase it.
We can't increase it, so if we
If I were
advertise.
to advertise the roll, I could advertise the rollback rate, if that's what you so choose. And then we can come back and adopt it. I would really like to have a conversation about that next year, because it would change all the numbers on the page. So it's a little late in the stream here, so.
Okay.
But that is a possibility. I think the county has actually started doing that. So it could be done.
Are we done?
But
I'm just looking for input, if anybody else has anything else to say.
But if you're not, seriously, if you're not really gonna, if you're not considering seriously adopting the rollback rate, then it's just a lot of trouble, so I don't know that it's
Well,
worth it.
can you run the numbers real quick to tell me what the difference will be?
It takes a little time, but I can do it, yes, sir.
Next, I have one other. Is there,
Now,
What's a little time?
it takes the balance of the day,
okay,
but I can do it.
I'm gonna give you some.
This has got to get to the newspaper, like
They
now.
do have a deadline, or it will advertise on Thursday.
But I do think Chris has a valid point now. I mean,
I
that,
do too.
that is a
I
very
do
valid
too.
point, not, and, I don't want to disagree with him or not look at, every avenue just because we need to change some numbers or look at some things, so.
that's what I would like to know to make a valid, to make a decision, to know what, can we,
Is there any way to get a
Ballpark
rough
it?
estimate?
Yeah,
Yeah,
rough
a ballpark of what that would generate this amount? Not worried about the expenditures, but to know that it brings in this much revenue.
The current, according to the certificates of values, the calculation is the current year proposed millage rate is 5.031%. the rollback rate would actually be less. What the rollback rate does is it
Gives you the same amount
gets you the same amount of revenue that you had last year.
unless your tax rate was.
So this would cause the millage to go down.
Even though property value, excuse me, even though property values are going up,
Yeah.
it still would be the same if you adopted the rollback rate?
No, it would be less. You'd actually get less revenue.
We would get less revenue if we went with the rollback rate.
Yeah.
This year because the rates, this proposed increase, correct?
Yeah.
Okay, what's the maximum required local effort?
5.03.
That's the max? That's, would that not be the minimum?
That's what the state requires, 5.03.
That would be a minimum, that's right, I like that.
Right. and that
That's
would
what
be-
they require in order to participate in FELP. So the rollback rate is actually less than that, so.
But you can't do that,
Well, you could do that if you wanted to walk away from the FELP.
which we obviously don't, so.
I mean, in some years it's inverted the other way, where the rollback rate is higher. Because, I guess because the property values went up 1.5%, and the millage would actually be less.
You're gonna also walk away from the isolated school bill, which generates approximately $1 billion.
Right.
If you don't.
So what in effect,
Right.
Chris, what you're saying is if I were to advertise the rollback rate, then Monday, when we have the hearing, you'd have to increase the millage in order to
Okay, what I'm asking is, I think we're missing. So here, I want to know what the maximum required local effort
I
is.
just told you 5.03 point.
But that would be, that's,
What the state requires.
right, so that's the minimum. They're, to be in FEP and be the isolated, that's the
Right.
minimum. So there must be a threshold higher than that you can go to.
No, that's what they call it the required local effort. That is the number they require.
That's their main thing.
That is their number, so you can't exceed that rate, and you can't be less than that rate if you want to participate in the
So it's a statewide
FELP. It
policy.
says required, that's the operative word. It's required.
But there's other districts through referendum where levy more. Am I
Yeah,
correct?
if you have a referendum,
But
you
it's
can
got
have
to be
an
through
additional
referendum
revenue.
to
Yeah,
an additional levy.
you can add a levy. In some years, the rollback rate is higher than the required local effort. This year, it is not.
Do you have any insight on this?
I think all the information you're being provided is correct. That's my understanding as well.
Have a motion on the floor. Any further discussion?
I know that there's another way that you can, your millage rate has to be, you can make it higher, and you can come down on Monday night, but we cannot go up.
That's right. In some years, the rollback rate is higher than the required local effort. And that's what the county has done the last couple of years. They've advertised the rollback rate.
So basically, if we advertise it at the rollback rate, and then since that goes down, since that is lower than this Monday, we would not be able to raise that
The
back.
rollback rate is lower.
That'll be one track.
Rollback rate is actually,
That's
this is
correct.
required local effort.
Interesting. So we advertise it as a rollback rate, then we come Monday and say, well, no, we don't want to do that.
We'd have to
We
raise
have
it.
to,
I thought you said we could not raise it,
You can,
that we could lower it, but we couldn't raise it.
Correct.
That's like-
Right.
The last several years, if you adopted the rollback rate or had this conversation then, the rollback rate is higher than the
I
required.
was just pointing that out for myself, hopefully for clarification.
that's part of this number.
We don't-
It's, there's additional discretionary millage, it's levy.
when do we advertise that?
It's all in there.
That's right. So we want to compete with this one.
Correct.
So we're, so how do we increase, how can we increase that?
Can increase it.
We can't increase the basic discretionary operating.
Unless you have a referendum on it, right?
It'd have to go out as a referendum to the county. How to increase the millage.
Well, who sets that rate?
Department of Revenue.
My opinion, is, and I'm gonna share it with all of you, whether you wanna hear it or not. That I think we come to the point now that it's too late to do anything for this year. Mr. Clement, I think it'd be very beneficial if we get these figures a couple of weeks, or 3 weeks, or 4 weeks earlier than what we get today, if that's possible.
I got this information from the Department of Revenue Thursday.
Okay?
I worked on this a couple of weeks ago. I don't know how I can get it early.
Well, you can. We didn't know that.
I mean, they released this stuff right at the last minute here. So, I don't like the process, but
Right.
it is what it is. I don't know how to.
I concur, and that was something I was gonna address after we voted, so in saying that I don't like coming in and us having to make a decision right now. And
Well,
I
you're
feel
not
like
making a decision right now.
but I feel like I'm being somewhat backed into a corner, that I feel like there's a way, and I realize you have much more knowledge and experience with this, so. But as far as, if we wanted to go on the ballot with a referendum, it's not too late with that. I do know that.
No,
I
that would be
contacted the supervisor, so I do know, I've followed through with that. It would probably be tough.
We need to
get
start
it
that
passed.
conversation earlier,
Right.
like January.
I agree, it would probably be difficult to get it passed, because we would need to be.
Well, not just that. In order to meet trend, this has to be advertised. We have to have the hearing. We have to have 2 public hearings, and there's a calendar. July 1 is the beginning of the clock. Whenever the property appraiser delivers the values, on or before July 1st, that's when the clock starts. And you have so many days to get this done, the hearing's done, and have the final hearing. So if we're gonna do that, I think that's a doable idea, but we just need to start that idea back in January.
And I think we need to have a workshop on it.
Right. I agree, so.
Okay, we have to do that.
Yeah.
I call question.
Mr. Attorney, you had one comment?
It appears that the 2 germane situations are dependent upon the advertised as the rollback rates or the rates that are presented here. Those are our 2 options, let's say next year.
Right.
Okay. So would it be feasible, when you get this information, let's say on Thursday, as you're calculating this and bringing it to our attention, to bring,
I could
which
send you
would
the
be
email.
best, but I'm just saying, when you're standing up before us, from my perspective, you kind of making a recommendation. Okay, this year, ladies and gentlemen, the tax worked out better for us to pass it at the rollback rate.
Right.
Or propose that at the public hearing that we have.
Okay.
Is that, I mean, am I kind of
Sure.
correct? And that's not, I know you worked on it over the weekend, which thank you very much. But those are the 2 germane issues there. And you could give us
I could.
recommendation
Sure.
for us to deal with, then recognizing also that we can do the referendum, you know, at the same time. Okay, thank you, Mr. Chair.
Well, you know, and defend him a little bit here. He didn't have a lot of choice. He just got to jump on Thursday.
No, yeah. I mean,
I don't think we're blaming anybody here, but.
No, I don't take it that way. I understand what you're trying to say. You just want to have options, and
Well,
I get
yes,
that.
he's exactly right,
Know what your options are, so.
and maybe have no option earlier in the game too.
Yeah.
Yeah, and I'm be the first one to say, I really, like to look over this and read it and ask about a million questions.
Sure.
Just present it right here in front of you. You don't really thoroughly get to just evaluate and look at everything, so.
Well, that was what my comment or my request was, since he gets the information so late, there's not a whole lot else that he can do, other than he could, in making these calculations, determine which would be the best option for us this year. Advertise the 0.25 or the rollback rate. And let's be ready then to either move forward with a referendum, like Mr. Collins was indicating, or choose the better one. Thank you, Mr. Chair.
So all in favor of advertising the trim calendar as presented, please signify by saying aye. Aye. All opposed, nay. Motion passes. Thank you, Mr. Clement.
Thank you, sir.
I'll be happy to talk to you one-on-one, when they want to come to office and try to explain how we get to this point.
In Gilchrist County, do they do the 0.25?
0.25?
What's their discretionary?
They do levy the discretionary, yes, sir.
Ms. Pam, is there any additions or, correct? Oh, I'm sorry, thank you, excuse me, thank you. I wonder why you're getting all ready for. Mr. Edison.
Thank you, Mr. Chairman. I think. I have some board policies for your consideration. And first off, I want to take them in two groups. And that balance out stuff, we're going to say that one for last.
Oh, good.
There's a conversation there. Okay? Let me kind of remind you on how this stuff works. We work, a part of the service that we get through NEPAC is that they have a whole legal department. And many districts use this legal department to help them draft board policies. And, you know, through the summertime, you have the legislation that happens, and then that legal department looks at, they have these model board policies. Yes, sir.
Is this part of what we already pay for, or is this an extra charge?
In fact, there's not a charge for this.
Okay, this is what we pay for, the full.
Well, it's not a service that we pay for, this one, for the contract.
Thank you.
Okay? So they look at all the legislation and they draft on all the policies and then react to it. Now, I don't have all of those yet, okay, but I do have some stuff that was in the past. And of course, there's some things that happen that, you know, local decisions that we make and we change some policies. So anyhow, that's where the changes come from, okay? We're going to start off with the easiest to start with. And first off, that's the wellness policy. That's 4.141. And it's required to advertise this every year. There's no recommended change to the wellness policy. But by state statute, we have to advertise this every year. Okay?
Hey, we can put in policy for all employees to go to the care center for wellness.
So,
If you want to get your money.
yeah.
Can we do that, Councilman? Hey,
I'm not an attorney.
We stayed at a Holiday Inn.
Holiday Express, thank you.
All right, then I'm going to take it in numerical order. And 4.14 is health, safety, and physical fitness, and this is just bringing our policy up to statute. Okay?
do we have a comprehensive physical education policy?
Yes.
Okay.
Right, okay, so one-on-one counseling concerning the benefits of physical education, what, is that gonna be additional requirements or things we have to do?
That's part of the classroom instruction that they have within the physical education program.
This is the main code.
Okay, excuse me, how that
Who is
was,
the
you're right.
wellness committee?
Sir?
Who is the wellness committee?
Well, Ms. Jones, you want to extrapolate on that?
The wellness committee is made up of a wellness contact for each school, appointed by the principal and members of the school health advisory council. And those two groups generally meet together, since often they are the same people. But Becky Tyson is the one who is chair for the wellness committee.
All right, then.
That goes all the way through for all 12 grades?
Well, in physical education in high school is a little bit different. There's one, depends upon which diploma option you want to go to. If you opt for 24 credit diploma, there's a 1 credit requirement for physical education. If you opt for the 18 credit diploma option, there is not a physical education requirement.
Thank you.
Then board policy, I think it's 6.20. This is just, as you know, that we've updated through Skyward, and our leave process allows employees to electronically or through Skyward to submit sick leave. So instead of just saying, I mean, we still have folks that do it in writing, but we have most of them now that do electronically, so I just put it electronically. And board policy 8.19, the recommendation is to include synthetic tobacco as well as electronic cigarettes, because that's a growing trend.
Okay, so this means that anybody that goes to a football game, they don't chew tobacco, they don't bring it, they don't have it in their pocket, we're gonna enforce that, all that good stuff, that's what that means.
Well, when they go to, they can, my understanding is that, I mean, if you have a pack of cigarettes in your purse, or if you have a pack of chewing tobacco in your purse, If you go to a football game, that's fine, it's just you can't partake.
All uses of the back, not possession.
Right.
And so that means we're gonna enforce that, and we see them at the football game spitting or something, we say we can't do that.
It's,
I mean, I agree, I know, I'm 100% for this, I just think, you know, us enforcing it is difficult when you see people.
It's difficult.
But I mean,
and
I
will tell you-
agree with it.
And I will tell you, as an administrator, there's sometimes where battles you have to pick. And certainly, you know, if you got one situation you're dealing with that's more health and safety oriented than some guy over here with a pitch of stuff, that's what you're going to deal with at the time.
through some SWAT grant dollars, tobacco grant dollars, we did purchase signs for all school campuses and banners for all school campuses. And we encourage schools to make an announcement at those outdoor events. And so that policy allows us to enforce.
Yeah, the tobacco policy has been in.
Yeah, it is, and I mean, I think it's absolutely great, absolutely great.
I haven't heard of any issues, but I can't sit here and say that it has been strictly enforced.
Right.
Right, yeah. Well, like Carol, she's gonna tell you.
You gonna tell Noel Call he can't chew it long?
Well, you know, he's not sitting with the rest of the crowd.
Okay. But he still has his couch there on the other end.
He actually has a golf cart now. They let him sit on the golf cart. And so, no, we're not going to mess with Coach. Just like as he said, you know, figure out how you're going to enforce these things.
Pick your battles.
Some things are grandfathered in.
Some, I think you might be pretty all right.
All right, now we're going to get into the other policies, and let me tell you why you have these others. If you remember a little over a year ago, there was standing up here at this podium, was a little blonde-haired girl from Chiefland and a little redhead boy from Wilson. And they were the president and vice president of the Levy Area Student Council. And part of their recommendation is that they wanted to have a weighted GPA on the report card. Okay, so that's why you have all these documents. Okay, and I will tell you right now, all of our high schools, because of the increase in accountability and to encourage kids to take AP dual enrollment classes, would love to see on the report card weighted GPA. Okay, and Carol, Candy, and all the rest of y'all might think you see that. So that's why we're here today. And you're going to have some choices. I've got options out here. And at the end of this, when we're all said and done, you can advertise all, some, or none. So, to start off with this, you have this document right here, which is at the end of draft day. Okay, and I've got some extras if you want some.
What are you referring to there?
This document right here, it's the last page of draft day.
Number Roman numeral 11.
Roman numeral 11, yes. This comes from the Comprehensive Student Progression Plan. Now, first off, there's a difference. If this is what you want to do, you can approve this today and it becomes policy. Comprehensive Student Progression Plan does not have to be advertised for 28 days. Okay, if you approve it, it becomes effective. So if this is what you want to do, today you can make that decision. Okay, this portion alone. All right? So that's where the grading, grade point averages, that's where it's housed at. So that's why this is coming to you. Currently, let me tell you how things work right now. We're in a Valley South. Currently, we have a weighted GPA for Valley South purposes only. And it is the Bright Futures GPA. And it is a 4.5 system. What that means is for any level 3 course, okay, first semester is an extra 0.25. If they make up whatever the grade they make is an extra 0.25 added to it. Second semester is an extra 4.25. So in other words, if they take algebra, if they take a dual enrollment course, if they make an A in it, okay, first semester and second semester, their overall GPA in that dual enrollment course is a 4.5. That's in their Bright Futures GPA. Okay, Bright Futures only weights certain courses. The only way level 3, the same criteria that you see here, okay? But they do 16 courses. They only count 16 total. So, for example, a lot of our kids that fall in this category, they're taking, that's 4 English, 4 math, 4 science, and 4 social studies, essentially. Most of the kids taking this started their high school career in 8th grade, and they're taking more than 4 credits. So what's going to happen is, say for mathematics, and say they're rock on in their junior year, they have 2 level 3 courses in mathematics and 2 level 2 courses in mathematics, okay, for their Bright Futures GPA. Well, their senior year, they want to do dual enrollment math. Well, what happens is that dual enrollment math will come in, and one of the level 2 courses will come off. So they'll have 3 level 3 courses, 1 level 2 course. Okay? So it's a moving target as it goes, the system moves. It changes with what the kids take. It's not a cumulative overall picture. Does that make sense? Okay? That's part of the reason you're seeing this change, because what we would rather do, we as an instructional team, we would rather just be able to take that 4.5 Bright Futures GPA system and put that on the report card. But Skyward cannot do the weighting system exactly the same as Bright Futures. It just is, it's not possible according to the Skyward people. So either we adopt something different to put a weighted GPA on the report card, or we don't, or we just keep what we have. Don't do it at all. So that's why I'm coming to you with this right here. Does that make sense?
So do other counties, they majority go with the weighted too?
Well, as this says, there's a lot of policies. First off, let's read the second paragraph. Okay, this weighted grades are for Levy County use only. Okay? Bright Futures, colleges, and universities, other districts have their own system of weighting grades. When you go to University of Florida, they're going to look at your transcript and they're going to evaluate it according to their criteria. If you go to University of South Florida, they'll have a different set of criteria. So everybody looks at your transcript differently wherever you go. Okay? The number of courses, and the way they're weighted are all different. And that's what's important to understand, is that everything's different from county to county for the weighting. What is consistent is the 4.0 system. That is the only state recognized system, the 4.0. Okay? Everybody does that the same. All right? So in other words, we can't say Levy County's weighted, you'll hear somebody else, I got a 4.42 weighted GPA. Doesn't mean anything because you don't know how it's calculated. But the reason the recommendation here is our students and our staff, they would like to, they believe it would be an encouragement if that was on the report card for kids to take AP and dual enrollment and level 3 courses. So that's why the recommendation is for their benefit. Okay, so that's why it's coming to you. But a Levy's weighted system could be totally different than Marion County's, Lobster County's, or anybody else's. So there's no statutory way to do it.
Skyward cannot do it the way.
Skyward cannot do it right way.
You can't do the .25.
Correct. And this is essentially what's most common, what you hear out there is what they call a 5.0 weighted scale. And essentially it's adding 1 quality point. For example, if I take that same dual enrollment math course and make an A in it, okay, so 1 point is added to it, so it's a 4.0, it's a 5.0.
And Bright Futures will weight it at 4.5.
Right. Bright Futures are going to do their own thing regardless of what we do.
Doesn't it seem sort of strange that Bright Futures is so important, Skyward can't adjust to that? Is that just me? Am I the only one thinking that? Am I the only one thinking we spend all that money on Skyward and they don't have somebody
Well,
else?
it's a moving, rolling target.
So are lots of things. We just talked about a moving, rolling target again, and we've got this.
Skyward comes from Texas. Those Texas, Illinois, from somewhere else.
So that explains all of it, right?
It doesn't come from local there, it comes from.
And to be quite honest with you, the way legislation is going, I don't know how long Bright Futures will exist. Because they keep cutting out that benefit, making it less and less harder to attain.
So when are you going to be ready to introduce or some comments, etc.?
Okay, well, first off, I mean, that's what this is. Any comments on this?
So this is not a policy, this is just a change in the progression.
Yeah, this would be, if you can adopt this today. You're going to have to make a decision on a couple of things. Do you want, first off is, do you want to weigh the GPA on the report card?
Would this, if we made a decision on this, affect anything, the decision on policies that we're gonna?
Right now, we have, I think, 2 other ways out there of calculating balance.
Well, let me start with the in the line, okay?
You know, that's what I'm talking about right now, we've changed it, I know, a couple of times. That we may be operating, those kids that are in the 11th grade going into 12th next year are operating under one set. And I think those kids that are either in the 9th or 10th now are operating under another set.
Everybody's on the same set of rules.
Everybody's on the same set of rules right now. Well,
That's good.
All right, well, first off, here's your options, okay? 4 options that I can recognize. Number 1, keep everything where it is right now, no movement. Okay? That's your choice. You don't have to do any of it. With weighted GPA, with balance cells, with a lot of board system, we don't have to do any of that. Okay? Second thing is you can adopt this, okay, and change nothing else. And just have weighted GPA over the report card. Okay? Now, what does that mean? It's like Mr. Trevor was pointing out, your Right Futures, your balance sal is calculated with the Right Futures GPA, which is parents have to go to the website to get it. Okay? You would have this GPA on the report card, and then also you have your 4.0 GPA, and that's what's used in athletics and everything else. So,
in that scenario, would it be possible for someone to have a higher GPA and not be evaluatory
well, higher which one?
on the report card?
On the report card, will only be calculated one, that would be
So that's,
possible.
that was controversial.
So that's why.
Calls it, yeah.
Okay, so that's why you can take and, if you so desire, you can take and, you can adopt this to be your balance salary requirement. Again, there would have to be a 3-year phase-in. And get rid of the Right Futures way to make this the way that you get used for balance salary.
Okay.
But there will be a 3-year phase-in for anything you change.
But we would begin making these designations next year for all grade levels, correct?
Yes.
It would start for freshmen this year.
Right. Incoming
I
ninth grade.
love these, but let's say if we adopt this, but let's say I'm a sophomore, we'll be a junior next year.
You're under.
I understand that, but let me finish, please. The report card, though, would designate these weights.
Yes.
For me, as a junior, even though it doesn't count for,
Right.
that's what I was getting at. And is that going to be a problem as well?
It's an education problem.
Yeah.
That is correct. Okay. Now, the third thing, or the last thing that comes out there, so you can adopt, you can keep your balance sal the same, okay? Or you can make the balance sal this, okay? So that's choice 2 and choice 3, as far as your weighted GPA. Another thing that's out there is the cumulative reward system. And this is on a separate piece of paper because this is normally found in the progression plan. Yes, sir.
If we go with just accepting item 11, that takes effect immediately, and that would be for everybody.
That's correct.
Just the designation.
Well, it is just adopting a weighted GPA system.
So if you couldn't be in the 10th grade this year, and us go like this, and you'd be balanced out.
I'm talking about
Just this page.
just this page.
Yeah.
Yeah.
Yes, that is correct.
Okay. And the other thing is the cumulative reward system. And I will tell you that there's great support out there for this. There's other people that don't support it. Okay? And essentially what it does is instead of, and you can do some sort of combination, but essentially what this does is it breaks down into brackets different award designations based upon their GPA. In other words, you won't just have a top 2, you would have a group of students, based upon what GPA they have, they can be cum laude or summa cum laude or magna cum laude or whatever. So you recognize groups of students based upon their academic
Let's
achievement.
just do away with the top 10.
Yes, sir, I would think so. Essentially, your top students would be in your top academic category.
So you could be recognizing more students.
Yes, sir.
Yes.
And that's why the like of this in our schools, by administrators. By the way, all of this was sent out to administrators to give us the feedback.
I think I mentioned this to you earlier and all, but could we do both? Could you take a valid sal from summa cum laude?
I think you can write up the policy however you want it.
Well, that's why I was getting ready to ask if you could just strike out number 3 on the second page. If that's.
Which second page?
Draft A.
I'm sorry, draft B.
Okay.
Sorry, I thought we were talking about draft B. So if you strike that out, then you have that ability to still have a val sal like you're asking, Mr. Turner. Yes, sir.
Yes.
With the.
I mean, I'm all for recognizing as many students as you can that earn it.
The only thing I have a question is, on the last page of draft B, commencement speakers are selected through the school selection process. Who is that and what is that?
And this, well, it's kind of like right now, your top 10 is, every school does it however they want to do it. So they have a selection process to determine their top 10. Okay? So in other words, the schools will determine who their speakers at the graduation ceremony are.
Okay.
Unless
So-
Yeah, let me give you a possible scenario, because this happens. Here's a cheating scenario, okay? This year, the valedictorian and the class president were the same person, okay? So that person got to speak essentially twice. I think she spoke twice. So in other words, through the thing, they may say, well, if the valedictorian and the class president is the same person, they might, the class president speak. I'm just saying, that's something, that's a local decision.
That's a school decision, that's not a district policy.
Well, that's what this means.
I'm still,
And every school has a different decision or a different policy right now on who speaks. They do it all a little bit different.
Or how long they
Yes.
But the speaking part doesn't necessarily go to the top 10.
Yeah.
Those are two separate things.
to me, you could increase the numbers that significant in the past, number 10, or about number 11. It was, this, that, and it's just that of it. But when you go with as many students as meet that requirement, you can recognize, and then the top 2, from my perspective.
So, and again, today's purposes, I just need permission to advertise all or part. Okay, we'll craft language, however you also desire later. And today's thing is going to be a permission to advertise.
I myself am a fan of draft B, and I'm all for letting the school side get to speak. Because they know what those kids actually did, I don't.
You're doing away with balance out.
Or you can take it at a later date, and you can write something, add something into the award system.
I'm fine with draft B the way it is.
Could we,
But if somebody's got a point, I'll listen.
Yeah, I feel like that we could advertise both of them. I feel like we need, ask questions and input. And, like Jeff said, it's great support, for some of these. I don't know, I haven't heard of that. I want to ask questions.
That's what I would
find out some
encourage you to do.
more about this. And I want to go to administrators. I want to go to, input and parents. And, I've been on the board a long time with, you get a lot of flack about this issue.
Oh,
It's
without
major.
Without a doubt. I'm referencing, I like the way that reads. I've also had several administrators and teachers say to me, we got to do that. This is the way, we really like this. And the fact that you, just like Mr. Turner said, what about number 11?
Yeah, but I don't have a problem with that. He wasn't in the top 10. Number 11 is lower, is higher than 10, lower than 10. He didn't make it.
But what happens when you get, what about 12 kids? What about 12 kids?
That's life.
That's
He
what I'm
didn't
saying.
finish in the top 10.
Well, but you'd have that same scenario with the, assuming that fact that the good law situation. You would just be expanded. You would not have a designated number, but you could still have what you said, oh, I was 0.01 away from being cum laude. I don't have a problem with
I
that.
don't have a problem with that.
And I don't think you do.
I don't have a problem if we got 50 kids graduating here, all 50 of them got one of these designations. That just makes
If they
sense.
qualify.
If they qualify, that's what it's
But if they
saying.
recognize the top 10 and number 11, that's not in the top 10. He didn't qualify.
I understand what you're saying there. But I'm also saying, this gives an opportunity for that kid who's number 11. He got a designation too. Does that make sense?
But if you keep balance out, that gives that kid
Who was the top? I'm receptive to it. Receptive to the idea.
Here's a similar scenario. Right now, and again, it's different in all schools, how they do the graduation ceremonies. A lot of the schools, they ask the kids that are this year, for example, if you ask the kids that were qualified for the Florida Academic Scholars, which is the top Bright Future Scholarship, to stand up. None of them qualified at Chiefland. Nobody qualified at Watson. You got one qualifier at CUT and a couple at Williston. Okay?
That were in the top 10.
Well, no, just qualify for the Florida Academic Scholar. You can be a Florida Academic Scholar, not even be in the top 10. Okay, different issue. Because it's about test scores easy. So, but then you've got your medallion scholarship and your gold seal. And you might have 12 students, you might have 22 students. But it's a category of students that meet this criteria.
Now, I have another question, go back to something you said a while ago. Like at graduation, usually, in my experience, Val and Sal is class president speaker. You say that's not true across the county?
Sometimes you have the student government president speak at one school, this one here, and who speaks at the graduation thing currently is determined by their school. But generally, the Val and Sal always speaks. Whoever else speaks up there, that's a school-based decision.
Thank you.
We've had 6,000 before. But one of the decisions, the only decision that I'm asking is if this is the way you want to go, I'd like some direction so that we get busy on it. If you'd rather table it and wait, that's fine too. But there has to be some configuration over there if that's what we want to do.
Do we need to have, what you asked you?
This, we can,
This
we can go
particular
ahead.
part, this comprehensive progression plan, there's not an advertisement required on it.
That's the 4.5.
So, or if you just want to wait, we can wait. We can do whatever you want to do.
So all we're talking about on this one is the weighting of grades, we're not talking about any designation, cum laude, Val, salary.
Right.
So we could go ahead and we can make this part of people's progression plan.
This piece right here.
That piece right
This
there.
piece. And again, this comes from the area student council recommendation. That's where it comes from. That's
Then
why
you
it's
want
here.
to advertise.
I will, this right here goes along with the policy on student audit. So, you know, I would wait on making a decision. My recommendation is for you to wait and make a decision on this. And if you adopt draft B or what you do.
Is there any form of advertising or anything?
This is people progression plan.
Okay, now, just so I'm clear on this, so you said that if we do adopt this, then it could be that they're making higher grades or higher on report cards than even like Val and Sal when they do determine that?
For a period of time, for a period of 3 years, it'll be three grade point averages. It'll be the 4.0, which is the state recognized grade point average. Okay, that's what Florida High School Athletic Association is. That'll be there no matter what happens. Okay? You have to phase out if you choose to do so, you have to phase out the Bright Futures GPA, or you don't have to, you can keep it if you want to. But the Bright Futures GPA, now that is not an advertised thing. Only the parent can go in through the portal, or a student can go in through the portal and look at the website and see what their Bright Futures GPA is. It's not printed anywhere on any information. Okay? But the students wanted a weighted GPA on the report card, and this is our solution for that. So you would have this, and because it weights the same courses, okay, but this takes into account all the courses the kid takes. Bright Futures takes in 16 courses. So if a kid has 27 courses, This is going to average with 27 courses. Bright Futures is only going to weight average 16 courses. So you're going to have two different numbers. And it is possible to have a higher number with this possible thing than it is the other. It's also possible to be lower, but I promise you it's different.
And you, what problems and issues you see with that?
It's an education process. You know, there's going to be conversations at the school with people trying to help them understand this, or some people.
For some people, and there's gonna be some people out there, they're not gonna get that.
Right,
It's
I
not
understand.
gonna happen.
I understand. I don't care what you do, there's going to be a process.
Right, there is.
I don't care
what
if you
you
make a
do.
decision different than what you're doing right now, there's going to be an education process.
I move we adopt number 11, the grade point average. Into the progressive plan.
Is there a second? Ms. Carroll, I think you're looking down for like.
Yes, sir.
I mean, I see so many potential problems, you know, I mean, I agree, and I don't disagree, but I also see, you know, the kids that are, they're gonna go in, they're gonna look, they're on top of it all the time, but then there's just so many problems. I mean, it's not that I don't disagree, and it's a great thing to, you know, have that, but.
So we have principals, guidance
Gotta break a few eggs to
counselors,
make a
other
cake.
people, you know, that's what we have assistant superintendents for. Would you please submit your motion, please?
I make a motion that we do number 11, formula number 11, the grade point average, adjusting it to the weighted scale.
I second.
Been motion to second, any discussion?
We have had numerous opportunities in the past where we have made changes, and people have even shown up at the school board meetings for things that would change. We've always worked through them. I don't see this being any different than this was calculated, even using the explanation. If you want to give us, principals, guidance counselors, anybody else, a cheat sheet. If a parent comes to you and says, why is my child's GPA recorded differently than what it is on Bright Futures? Here's your cheat sheet, guidance counselor, teacher, anybody, board member. This is why it is, and this is why it will only be this way for 3 years, because we cannot impose something on a senior this upcoming year. But we think it's in the best interest of the student and everyone concerned down the road, so that's why we put it in there.
When you say weighted GPA, this is what people understand. They don't understand the Bright Futures, how that calculates. But they understand this.
But they will see the difference.
Yes.
So there's going to need to be some explaining going on. And I think if we are all equipped with these explanations from the teacher right on to the AP, the counselor, right on up, it'll be the same thing. Somebody will still show up and sit in that front right chair, that's where they usually sit, or stand if we've got a boardroom full, and question us. And if we have a superintendent, an assistant superintendent, and Carol Jones sitting out there that can explain it, and we can explain it as well. So I'm strongly in favor of this, because 3 years from now, it will smooth itself out. And I think 3 years from now, we probably will not have these people showing up. I don't like the way this is done. Thank you, Mr. Chair.
But you're saying we're putting this in the plan this year, and we'll put it in the schools, and it'll be on there this year.
It's got to be, yes ma'am, it's got to be in there at some point in time for
Right.
it to be authenticated for this is what's going to happen, and this is how it's going to be done with this year's crop of ninth graders. With this year's crop of ninth graders or seniors, this is how that happened. All right, this year's crop of eighth graders, it'll be ninth graders next year, that'll be okay, because they'll start with it, and we'll have 2 years.
That's fine, that goes in, but this year's 12th graders are gonna have that on their report
It'll
card.
be on their report card, but it will not count as such. See, we can't establish these for this year's 12th graders.
Right, I know that, but it's still gonna be on their report card, and, you know, it's just
There's
gonna.
no way we can take it off their report card.
Well, I mean,
There's
I'm
nothing on
not-
there now. There's nothing on there now.
So if you're incoming ninth grader, can we put it where it's on incoming ninth graders? But
Well,
the-
I've asked that question.
But the
I would ask that question.
Sophomores, juniors, and seniors this year.
And I can tell you what the school's response is, and I can tell you what Mr. Davis's response is. First off, all of this is because the kids want to see the weighted GPA on the report card. That's why we're here. That's what they want.
Which was a recommendation made by Quincy and Sarah.
Right. So that's what this is about. Principals, they want to see it on there because they know the kids want to see this, and they want to encourage those kids to take the AP and go on to level 3 courses. Okay? That's why they want to see it. I asked Mr. Davis, can this just be 9th grade only? He says it's possible, but it would be 8, 9 here. So
Still possible.
He said the best plan of action would be to make it for all, to configure the system for all level 3 courses.
But then you, if you make that change there, Carl, you've got to go all the way back down to those, what do you call them in the schools? People that do all the calculating and stuff. Data entry clerks. And you talk about something, you know, they already have it, in my opinion, anyway, very difficult.
Our recommendation is if you're going to do it, do it. If you're not going to do it, don't do it.
So the benefit of doing this is so that kids will be able to see this weighted GPA on there, and we've got upper echelon kids who want this on there, who are going to keep up with this on anyway.
And to
I mean, Quincy and Sarah knew that joke coming. They didn't need that on their report card. Those two kids knew it.
But
They
it's
knew where
also
they're at.
to trying to get more kids to do dual enrollment AP courses to try and push them to see, oh, if I do this, that's a little incentive for me.
I'm not a dangling carrot guy. You need to be motivated. If that's what you want to do, you need to be motivated. So in all honesty,
One size doesn't fit all.
and well, we're trying to put one size on every kid right here with this.
This would have been a motivator for you then. And I think for a lot of students, it would be a motivator. We have students who don't take dual enrollment or AP because they don't want their GPA to drop.
Well, I think it would have been a motivator for me from the aspect that I could look at Chris Cow and go, hey, I got 4.25, you got a 4.0. That doesn't necessarily motivate me to take a class. That motivates me to brag about what I've got.
What Carol said is very important, is that they don't want to take a higher level course because currently, right now, if I make a B in a level 3 course versus taking a level 2 course and making an A, okay, that difference, since it's a 0.5, my average is going to actually drop compared to that kid down here that doesn't.
Now that is a better selling point.
Okay.
To me. Now to me. If you want to sell me on this idea, say that. Don't say because they're not on them. Don't say because Quincy and Sarah came here last year saying.
Well, this is a recommendation from that group.
They were representing.
Well, I understand that, but what I'm saying is, well, like I said, those are upper echelon kids. They're going to naturally gravitate that way. They're going to do that.
Your student government? Oh, upper echelon.
But those two,
Those two,
I'm only referencing those two. Those two are upper echelon kids. They don't need to see that on there. They're going to know. They knew. I guarantee you, they both knew where they stood.
And my daughter knew in the conversations that she talks, she knows that if she took an honors course and made a B in it, her GPA dropped. Right, there you go.
But to me, to say the better selling me on this idea, and I think better selling to the public of this idea, is to say, you know, you got a kid with the A in a regular course, and we're taking this B, is going to be better. It's, you know, to equate it to normal people. That's a better selling point than the kids want to see it on their report card.
And so that we can, relate and talk to, parents about that, so they'll understand.
That's pending, Mr. Asbell, on the fact how we go on the cum laude designation, the incentive, as I would see it, I stand a better chance of getting one of these designations. I take it.
Right, to me, and this gets all back to my point, that's a better selling. And what I'm thinking of is the way we have to talk to the general public. Now, I have to talk to people all the time that I went to school with, and we've all laughed about, hey, I went to school with your mom. I can remember being in school, and the guy who was a salutatorian in our class, way back when, he took basic math.
Amen.
The rest of us were taking all this stuff.
Right.
And this is something we have to equate to the people. I have no desire to look at mama and say, well, this is so that Junior's going to have it written on his report card that he now has a 4.25. I won't be able to look at the mom. That's not, and my harping is not on the idea, it's the selling point. It's not to say, yeah, see that, he's got that. No, it's to go, this is why that is that way, to answer that question more. It's more of what I'm bringing about. I want to have a good grasp of, this is why we're doing it. Not so the kids can look at it and get over there. It's mom and daddy going to want to know, now why is that figured that way? Because ultimately it's going to be, why's my kid got this and this kid's got that? And this is an equalizer as far as I'm concerned, if that makes any sense.
I think, Cameron, you're saying the same thing.
I think so. We're just looking at
You
it.
really are. You're saying exactly what the kids have said and what the principals and what the teachers are saying. That, you know, our job is to really encourage these students to reach their fullest potential. And if the fact that they're not going to be in the academic top 10 because they don't want to make a B in a more advanced course, then we need to find a way to encourage them to reach their fullest potential, which is to take those higher courses, those level 3 courses.
Okay.
And so,
And that's the struggle that the high schools have had since I've been here, is getting the kids, is a lot of them are chasing balance out, or chasing whatever honors there is, and they don't want to take the higher level course because it will ruin their grade point average.
And that's
Or
why
not ruin, it
the
will.
last 10, 15 years, there have been so many changes.
I think this is
So
a good
everything
thing.
you've seen happen is trying to get kids or motivate kids to take more advanced courses without penalizing.
Mr. Chairman, I have a question.
Any further discussion? All in favor, please signify by saying aye.
Aye.
All opposed, nay. Nay. Motion carries.
Now I need to know if y'all want to pass all these policies or advertise all of them or
So
something.
now you're talking about 4141 and 4414.
None of
Well,
those,
draft A and B, we want to, right.
How about 620? How about these other ones here?
you want,
6 leave and all that. You know.
do you want to advertise all of them, or are there any you want me to take out of the advertising?
I just want to clarify, I want to advertise both drafts,
Look, we're talking about others.
and the other ones too.
Yeah.
You want to advertise them or just pass them?
I think you want to pull that one.
We can't just pass these others, correct?
No, sir.
We have to advertise all of them.
Yeah.
I'm going to advertise all of them.
I'll second that.
Any discussion? Any discussion? All in favor, please signify by saying aye. Aye. All opposed, nay. Motion passes.
Thank you.
Thank you.
And I will make sure we put all the other designations in the screen as well.
Thank you, Mr. Edison.
Yes, sir.
Very enlightening discussion. Minutes, Ms. Pam, now I can say that. Is there any additions or corrections to the minutes?
Yes. On the minutes, page 1, I had left Cameron Asbell out as attending the meeting, and he certainly was here.
Mine was written in.
And then on page 6, I was trying to speak Spanish, and on the 6th line down, just a typo, I said, he said that C, a good indicator, instead of that is a good indicator. So it's just a typo on page 6, and that will be corrected. Those are the 2 corrections.
Thank you.
Minutes.
Move we accept.
Second.
Any discussion? All in favor, please signify by saying aye.
Aye.
All opposed, nay. Motion passes. Minutes are approved. Now, consent agenda.
Also have a couple of corrections on the consent. On the first page on the actual agenda, E, request for public hearing that Ms. Grayson just did, I had put 4.11 for the wellness policy number. It's actually 4.141. So that'll be a change. And then over on page 2 of the consent agenda, the regular consent agenda, student trip request number 1, the Johnson Middle High School football camp. They're also requested to take a county van. So it'll be 1 school bus and 1 county van.
Still no cost to board.
Right. And those are the only 2 corrections.
Thank you. Ms. Turner, do you have any comments on the consent agenda?
I do not.
Ms. Brogan?
No, sir, I do not.
Mr. Coward?
I do.
Okay.
On the gender equity,
Yes, sir.
I left that wrong.
So we're doing away with middle school football, middle high school.
They have elected to do 7, 8, 9, 10, 11, 12. So they still have middle school football. They'll allow those kids to practice. You can play middle school games and not play the ninth graders, or they can play junior varsity.
Gotcha, that's what I was.
You can still schedule games.
Good, yeah, that's what I was, all right,
So essentially, their supplement costs you give in.
and you're starting women's golf at Seafoam High School.
There's an interest there to provide.
I think it's been supplemented all along.
For golf? Yeah, sometimes they've used it, sometimes they haven't. There's been golf teams there based upon the need and interest of the kids.
So the principals are not always use those supplements, but they're still, that's correct.
And then on the Florida, I skipped over the Florida Learning Alliance. So this is going to track our teacher professional development, is that correct?
Yes, we currently use that.
All right. Good deal. Thank you, sir.
Thank you, Mr. Adams.
I don't have anything.
Me. I hear a motion to approve the consent agenda.
So moved.
Second.
All in favor, please, is there any further discussion? All in favor, please signify by saying aye. Aye. All opposed, nay. Okay, thank you. Mr. Evans? You got a comment?
I'll just let you know, or remind you that right now, currently our administrator is the superintendent in Flagler. That's at an ETEC training. And I know they're getting a lot of good training with Max Thompson and folks that were there yesterday and earlier today. And I can say this, and I think Carol and Candy will all validate this. In the many years that we've been doing this job, this is probably the busiest summer we've ever had. With all the teacher trainings, getting ready for the new legislation and all the blueprints for in-course exams. There's been a lot of work going on this summer in this county office. So people have done well.
And this is costing us $9 grand, correct?
Well, I know that
To pay the district assessment, $9,443.
he's on Florida Learning Alliance, I think. So it's wrong.
Are you on Florida?
Yes, I thought that's what the question was about the Florida Learning Alliance.
No, my thing is about the in-service the principals are going to provide.
Okay, but that's part of what the Florida Alliance,
No.
that's what the
The
teachers.
Florida Learning Alliance is really the data system that we maintain that will keep track of the professional development that everyone is taking and issue points and all that.
Administrators,
Right.
not everything.
All right, Mr. Turner, you have a comment?
I have a request, could, I'll reiterate, I'd like to look at all the AP check registers before the meeting, and having difficulty with my iPad getting in. And I request that when we have the packet sent out, that a hard copy be put in my packet of that.
Those are typically not available. Your packet goes out the Wednesday prior,
Yes.
typically don't run the APs until Thursday and Friday. But I can certainly bring a copy for them to the meeting.
That's how I look at it beforehand. So I may just write over it. If I write over it, they can request a copy.
Sure.
Thank you. That's it. Thank you.
Thank you.
Or I can mail you a copy if you'd like to do that. You'd have it over the weekend.
So let me try to find a time to either come by or I'll ask Ms. Turner.
Okay.
Walk over. Over the extra.
As soon as we run, we can run a copy for you. And I know it's difficult to read, I apologize. I've tried to
It is what it is.
talk with Defect about it, and their responsibility, we could mold it, make it a little darker. Can't really do much response.
Thank you, Mr. Turner. Mr. Moody?
I just had a parent mentioned to me that, and they've gone on the school board website, and then they went to the individual schools, their sites, and that I guess they were starting in Bronson, but they finally found it on the Williston Elementary School, the date of when school was starting, that over the summer some things hadn't been updated, and that it took them 45 minutes to kind of move through, and if there's anything that we could do to help and make it easier, that they were very frustrated with.
Here
So I just
is,
wanted to,
under documents,
Uh-huh.
we have the school calendars there, but we could probably do a banner maybe that says school begins on such and such.
right, and I think that's kind of, that's why they had to just look and search and find, and if they could just make it easier, so it, and that's all I have this time, thank you.
Thank you, ma'am. Mr. Cowell?
With school grades coming out, I don't know if there's a possibility, and I'm sad that the superintendent's not here, but I'm sure Mr. Jeff, you can pass this along. Like, the school improvement plans for our schools that are struggling or whatever, maybe have a workshop and have our administrators come in and kind of update us on what their plan of attack is, so throughout the county. So that way it's something less informal and it's not really an inquisition or anything like that, but just so we know that when we go back out and we're getting questioned on why a school is struggling, so.
With talk about school improvement plans and how things have morphed into in the past. They're very prescriptive based upon their student data with all of our schools now, essentially being Title I schools. And so everything they do has to go through and meet those Title I. The goals and everything else are set for them. It's identified for them. So the work that they're working on is that work that you're talking about, and that comes down from the state level. In other words, if there's an area of kids that are not performing, causing the school not to achieve, that's going to be an improvement plan. There's no avoiding that.
Right.
But if I think what I hear you're saying is, and I think they come to the board for approval on these school improvement plans.
Yes.
Yeah.
But I guess maybe less informal than a board meeting, a workshop where, especially if we've got schools that are continually not improving, so, and I realize there is a year where maybe a school goes from dips or whatnot and then comes back up, I'm not saying, but if a school is continually not performing to the standards that we want, and we're a C district as of right now, and I know we're waiting on high school grades, I would just be curious, so.
And I can tell you, we've kind of taken the differentiated support model for our instructional team and have applied that to our schools. And we're going to be giving the schools that need more support, they're going to get more support from us. And we have an instructional team that made it I don't know what the right word is. We're going to be out with the schools much more, supporting the administrator and supporting the teachers in what their jobs. And that's part of that differentiated support. Some of the schools will have 3 or 4 of us in their schools, on a very regular basis. And just to make sure that we're giving that principal the support they need so that the instructional strategies are being implemented the way they're actually supposed to, and not leave those principals on the island. So that's something that we've already done. I don't know if Carol and Candy can address that. Something part of it.
We're all assigned to be at schools on a regular basis, and then we'll meet every Friday as a team to discuss what's going on and what our action plan should be. I think what you're asking for is an action plan from those principals, and I believe that they are all madly working on them. They've been bringing in their lead team. They'll have a designated day. Most of them are either going to meet on August 5th, 6th, or 7th. And they will be working with their teachers on that action plan and what that should look like. We actually have, and if any of you are available next week and maybe want to come by, we're going to be meeting with the lead teams from each school next Monday and Tuesday to address the Florida standards and new assessments and how we're going to develop an action plan to get our students there. So we're actually going to be meeting at Bronson Elementary School. We're going to be using their cafeteria and their media center. We're going to start out together and then we're going to divide up. So all day, Monday and Tuesday next week. And that way you can get a little eavesdrop in on some of the action plans that are being developed, but I think it's an excellent idea for the administrators and a lead team member maybe to come and do a short presentation to you on each school and what their action plan is to address their major areas of weaknesses. But we will be meeting weekly on Fridays as an instructional team, and we have developed an actual calendar that we will all be using to designate when we're going to be in the schools. Each school has 3 of us assigned to them.
And by no means do I think that we leave anybody on an island. I think we give a lot of support, and I think this will be another way to show that administrator lead that we are behind you.
Absolutely. I think that they need to see it and they need to feel the urgency like you do, because you're out there hearing from the parents and daily, you know, and you need the answers. And I think
Carol, start 8 or 8:30?
we start at 8 o'clock. 8 to 3:30 Monday, or might be 3. I can't recall. That's 8 o'clock.
Yeah, also, can I ask too,
They'll shrug their shoulders when they say no.
Chris brought that up too, like with, you know, they're getting the support, they're doing everything, but what about those schools, what about those principals that year after year, if they've had a low grade? What are we doing about that? I mean, is there something we can do about that?
Well, that's all a part of the evaluation process. 50% of their evaluation is their school performance.
The administrator of the school.
Mr. Lee, you had something, sir?
I just would caution board members, since this would be not being advertised public meeting, you could have more than one board member drop by at a time.
I have scheduled yourselves.
I'm not gonna be there, so go ahead. I can't make it those 2 days. But I appreciate Carol inviting us and the opportunity there. I think that's great.
I mean, what's to say that I wouldn't go to Bronson Elementary the same time that Cameron was there dropping his kids off? So I don't agree with that. But I mean, if it's not random, I mean, we're not.
Here's the distinction, and I think I can help. That's perfectly okay for 2 board members to be in the same location at the same time, not an advertised meeting. But if we have a special meeting to improve school performance and strategies and things that are clearly going to come back before this board to vote on, that's what you can't have 2 board members act on.
I don't think we would be voting on anything from these workshops.
But the type of issues that are gonna come before the board, not my rule. Lots of Florida cases have said you
You're
should
talking
not
next
have,
Monday, Tuesday?
or the Friday meeting.
No, I'm not inviting them to Fridays unless it meetings.
Okay.
Fridays are just us.
Okay.
They don't want to come and meet with us. Fridays are just the instructional team. But
I will make it a point to schedule some more time.
and I think the schools actually, though, we can have the schools invite their board members to their day.
Mr. Blake.
And they'd just be you at your one school.
Right. Might be a better way. That way it would.
Mr. Perry, you have another comment?
Yes, it did. Are you saying that it's against law for us to even be there at the same time, or if we have discussions about those things?
Discussions are clearly over the line. I can show you cases where judges have said that you should not be, and Attorney General opinions have said, you should not have 2 board members at a non-public meeting, even receptively hearing from administrators or hearing about issues that are coming up. I don't think that's the letter of what the Sunshine Law states, but what I'm telling you is that's how it's been determined.
Mr. Turner, you were right.
But I'm just trying, I mean, you and I show up there at the same time, you make sure you're.
We'll stay away from each other. Hello, Mr. Turner, how are you? I'll walk to the other side.
And I could provide the board some examples of what I'm talking about.
I'm not questioning what you're indicating.
I agree with you that that is not what the specific letter of the law states, but that's how it's been.
Walk in and walk out.
I'm good, thanks, sir.
Mr. Adams.
One thing I have is, a while back, we talked about some land, various land we don't want to sell off. Have we had any interest in that?
Well, yes and no.
There's your answer.
Moving target.
We have the house in Cedar Key, Mr. Lenny, correct me if I'm wrong on there was substantial work done on the title of the property, because my understanding is that the house was mortgaged for substantially much more than what it was valued for, and so that was out there with the bank. And I know we have the title to it, but you still have this thing on, so we had, is it quiet title?
Quiet title action.
Quiet title action. So we have essentially settled with the mortgage company that had that, or the value of that house. I think that's, settlement was $5,000. Okay, is that correct?
Yes.
Okay. So we couldn't sell it without a legal battle. Okay, so we settled with the mortgage company. The other Bronson properties, I have not heard any response on.
That's all I got.
That's all I know.
Everything else I want to hear about, I've heard.
Mr. Lady, you have anything else, sir?
No, sir.
Do we have any, do you have any predictions on how many of them?
High schools that I've talked to feel very positive about their results. I don't have any predictions on them, but they do feel that they're going to, most of them feel like they'll be at least at these schools.
Mr. Chairman, could I?
Yes, Mr. Clement?
You should have in front of you some information concerning our projected fund balance for this past year, 2015. From our workshop, where it looked like we were going to be even, we've had some additional expenditures, in-service training and things that's happened in June. So, in addition to that, we transferred $100,000 to the food service program. So at this point, we're underwater by $239,000. Just wanted to point that out to you. Our fund balance is slipping a little bit from where we talked last time. Also, I have a copy of the trim information. It's not the entire book, but it's kind of a summary. Thought you might want to take a look at this, so when we have our meeting Monday, you'd be a little more prepared to ask questions. Maybe we'll answer some questions going forward.
Thank you.
So as of July 1, our fund balance is 3.81%. Is that so?
Yes, sir.
Okay, anything, you got a comment? Like, remind people that there is a new employee orientation on August 5th. That's the same day as the board meeting that night. And I think that Ms. would like to have us there, people can be there. And that's at Bronson Elementary Cafeteria.
Probably need to advertise
Administrative, also the administrative retreat is
August 7th.
August 7th. Mr. Turnbull, we mean
I'm
spirit.
not being mean-spirited, I'm just, what Councilor said about
Let me ask you more questions about
So we have to go one at a time?
I introduced them one at a time.
it. And I'm not being mean-spirited. Right.
Good question.
Okay, so no other comment? Meeting adjourned. Thank you for coming.